Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Should I worry about numbness in my arm? It's understandable to be worried about numbness in your right or left arm. Keep in mind that the sensation may be temporary, caused by something like sleeping in the wrong position, which is nothing to be concerned about. /r/n/r/n However, numbness may be caused by a sudden health emergency, nerve disorder, or nutritional deficiency. If numbness recurs or includes symptoms like chest pain or dizziness, seek medical assistance right away. /r/n/r/n Determining whether numbness occurs suddenly or gradually and whether there are other symptoms can help your healthcare provider diagnose and treat the condition. /r/n/r/nwutwhanfoto, Getty Imagesrnrn Poor blood circulation in your arm could cause numbness and tingling because the nerves cannot get enough oxygen. A number of conditions can interfere with normal blood flow. These include /r/n/r/n One of the most common examples of sudden numbness and tingling is the feeling that your arm has fallen asleep. This usually occurs after sleeping in a poor position or leaning on the arm for a long time. /r/n/r/n Known as paresthesia, this sensation is related to the compression or irritation of nerves. /r/n/r/n Sleeping on your stomach is likely to cause loss of blood flow to the nerves, while side sleeping may be less of a risk as long as you keep your wrists straight. Paying attention to proper spine alignment when you sleep is the best way to prevent arm numbness. /r/n/r/n While arm numbness related to sleep positions or temporary pressure resolves on its own quickly, other nerve issues may be more serious. /r/n/r/n Numbness that persists may be related to an injury or underlying health problem that affects the brachial plexus, a group of nerves that runs from the lower neck to the upper shoulders and controls movement and sensation in the arms. /r/n/r/n Possible injuries that affect these nerves include /r/n/r/n Diseases and disorders that can cause numbness in the arms include conditions that affect the nervous system such as multiple sclerosis, fibromyalgia, Raynaud phenomenon, and shingles, herpes zoster. /r/n/r/n The relationship between arm numbness and medication is complex. /r/n/r/n Be sure to tell your healthcare provider about all medications you're taking to determine the relationship between the medication and your sensory changes. /r/n/r/n Diabetes is not the only cause of peripheral neuropathy. Nutritional deficiencies and vitamin imbalances can also damage nerves and cause a loss of sensation in the left or right arm. /r/n/r/n The most common sources of problems are a vitamin B12 deficiency and an excess of vitamin B6. Alcohol dependence and other disorders that affect nutritional intake can also lead to nerve damage. /r/n/r/n Arm numbness or tingling are fairly common symptoms that can be caused by various medical conditions. Sometimes this symptom results from your arm falling asleep, and it could resolve after just a few minutes. /r/n/r/n However, arm numbness and tingling may also occur due to neuropathy, a chronic and progressive type of nerve damage. It may also suddenly occur due to serious conditions, such as a heart attack or a stroke. /r/n/r/n If you are experiencing a sudden onset of arm or hand numbness lasting more than a few minutes, you should seek prompt medical attention. If you've been having intermittent numbness in your arms or hands, you should make an appointment to see a healthcare provider as soon as possible. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.